I was living in Salamanca in Spain in the 90s when I first became very ill. But the doctors there didn't quite know what was wrong, although they knew it was some sort of inflammatory disease. And I'd heard of the Mineral Water Hospital because my brother-in-law lives in Bath, and he contacted his GP, who happened to be Dr. Rolls. And he said if I came to Bath that he would see me and refer me to the Mineral Water Hospital, which he did. And he got me admitted the following day, which was quite amazing. That was Violet Prince ward, and I was a bit shell-shocked when I first got there, but I couldn't believe how kind and helpful everybody was, because I'd come from a situation where I was just a problem and nobody knew what to do with me, and I didn't have any help. And everybody was so kind and just wanted to help. And after lots of tests and things, I was diagnosed with psoriatic arthritis mutilans. The treatment was amazing. You had a session of physiotherapy and hydrotherapy every single day, apart from weekends then. We were let off at the weekends. The physiotherapy was very, very good. But the hydrotherapy was wonderful. It's the best thing to do, it really is, because I was able to move quite freely in the warm water, and it was wonderful just to be able to move and not feel quite so much pain. Unfortunately, they still couldn't get on top of the inflammation because I had a very severe strain of the arthritis. I tried a couple of different things, but nothing seemed to work much. It was just a case of trying to keep my muscles strong. And at the time I didn't have anywhere to live, so apart from a few weeks break when I was in Frenchay, I was actually at the Mineral for 9 months.
Gosh.
While I had an amazing team of social worker, occupational therapist and physiotherapist. That was Jenny was the physiotherapist and Colleen was the occupational therapist. And they contacted social services and found me somewhere to live, which was absolutely incredible. And they really enjoyed it because they could follow my pathway all the way through from being admitted to actually setting me up at home with all the right gadgets and adaptations. It was incredibly difficult, but somehow I managed, and I was having care come in twice a day then, which was really good. And it was just so nice to have somewhere of my own, it really was. Yes, I had sort of spells of physio and hydrotherapy, and then in 2006 they offered me the chance to try the biologics medicine, which was then called anti-TNF, and that was absolutely incredible. Before my first treatment, my ESR, as it was called then, was 110. After my first treatment, it went down to 30.
Gosh.
Second treatment, down to 2, and then 0, which was incredible. It made such a difference. I'm still on the same drugs. I'm doing pretty well, actually. I didn't expect to be this well sort of ever again from the state I was in before. I have had a lot of corrective surgery because it is such a severe strain that I have. But I'm doing quite well. I would like to mention that I can remember some of the nurses on Violet Prince. In particular, there was Marcia, Maureen Papa, Petra, Spanish lady, Rose, Chris Harland was then a mere staff nurse, and lots of others.
Yes.
And Petra, the Spanish nurse, was She loved to bath people, but there was very rarely time during the day for people to have baths. Everyone was so busy all the time. But she would go and look at the timetables when people had their treatment for physio and hydro, and she would work out which patients she could bath in the morning. And she'd come up to you and say, "Would you like a little bath?" And everybody's just saying, "Yes, please." Because they had a huge Arjo bath with jacuzzi, and it was fantastic. And she could do 2 or 3 people in the morning, which was amazing. Yeah. My treatment stays the same. It's the same team, which is really good. Didn't really like, well, no, I don't like leaving the Mineral Hospital because it's had so much character and history. But times change, so we'll have to embrace the change.